Let's roll.
How's my hair? Did I mess it up?
Okay.
Good to go.
This guy's on, so everybody's on.
Benjo, are you on? Do you need me to speak up a little bit?
I didn't count on the dogs being in the shot, but this is really what life is. So.
Okay, difficult question to start. What is your name, your age, and then just tell us a little bit about kind of your background, what you do for a living.
My name is Shelby Hedgecock, and I'm 29 years old. I live in Los Angeles, California.
So my name is Sarah, and I am from Kansas City, Missouri, the Missouri side. Very big distinction, yes.
My name is Emily Zayens, and I'll be 41 in 3 weeks. And what was the other one?
So right now I am an account manager. I work in marketing, and I do marketing for real estate professionals.
Yeah, I'm 42, and I'm a mom and wife and a dog mama. And I was a professional artist. I'm trying to get back up to that level.
I have a master's in peace education from the United Nations University for Peace. And since I got that, I've been really specifically working in the field of transformative education.
I'm very involved with church, and I was able to be in a presidency over the women's organization over 9 congregations, and we do trainings, and I go to different congregations and speak.
So leading up to being sick on April 6th, I was doing great. I was sleeping so much, and eating really good food. I was having dance parties in my little RV.
I went through this whole fitness transformation. Like, my body was on point. I was so strong and healthy.
It was going really well. Got an award for a book I illustrated, and that was exciting. It really felt like I was, finally getting some traction.
I was about to launch my wellness program and help people mind, body, and soul.
Yeah, I was feeling vibrant. So that is kind of surprising for how hard I was then hit.
So I was doing everything that I loved, and it was just kind of perfect.
And then bam, I got hit with a train, with COVID, and it sucks.
And we thought, oh, give it a few weeks, and then, oh, give it a month, oh, give it till summer. And I still wasn't where I needed to be.
The rug was completely pulled out from underneath me, and my time in bed went up 70%.
And it's just like things have just continued to snowball.
And then POTS kind of symptoms.
My new diagnosis of POTS.
I have the POTS.
Where you get dizzy and whatever.
And constant chest pain and shortness of breath.
I was sitting working at my computer at home, and my heart just started pounding, and I'm sitting down and I'm like, what's going on here? And then my pulse was like 140 something or something like that. It was just insane.
The racing heartbeat stuff, and they're like, are you anxious? I'm like, I'm laying in bed, I'm just waking up.
It almost feels like my body is frequently telling me I'm at war, and I'm not, but all of my defense systems are up being like, oh, this thing's happening. We have to fight it.
So symptoms started with the headaches, the GI issues, and then it just progressed rapidly.
So I'd have tons of gurgles, I'd be nauseous, I'd be almost passing out, and they're like, well, you need to get up and move around. I'm like, yeah, that would be great, wouldn't it? If I could.
And then the fatigue and brain fog and weird body pains. Oh, lots of headaches too.
Just the debilitating fatigue. It's hard for me to read because of the cognitive issues that I have.
I've lost basically everything. I can't draw. I can't do my church ministering. Had to resign from that. I'm not a mother. I'm not a wife. I have to rely on everybody.
I cannot be guaranteed to not be in bed all day.
I've been dealing with this almost a year.
Yeah, so 9.5 months.
I don't know if there's really an end in sight, honestly. I don't know what that looks like.
Okay, let me pause. Okay, my brain needs to rest.
I'm Morgana. I'm a humanitarian, photographer, and filmmaker. And this is my husband, Jaco. He's a helicopter pilot. In 2014, we were living in Liberia, West Africa, when the world's largest Ebola outbreak erupted. I helped PCI Media share Ebola survivor stories through radio, TV, and social media, reaching nearly 10 million people. It helped curb the spread of the virus by driving changes in attitudes and behaviors. I saw the impact the storytelling had on communities in the middle of the outbreak. So when COVID-19 started spreading where we lived in 2020, we began documenting and sharing stories of COVID-19 survivors in New York to spread awareness about the disease. But we decided that wasn't enough. We wanted to show how COVID-19 is impacting people across America. So we moved out of our New York apartment and we moved into a 19-foot trailer so we could document COVID-19 survivors in all 50 states in America. As we interviewed more COVID survivors, we heard more and more about something called POTS. So we reached out to the head of the POTS clinic at Johns Hopkins to learn more.
My name is Dr. Tae Chung. I'm an assistant professor at Johns Hopkins University. I'm a director of Johns Hopkins POTS clinic program. Well, POTS stands for postural orthostatic tachycardia syndrome. It's a clinical syndrome, so that means it can be caused by a lot of different disease conditions. And as a final result, they can have POTS as a clinical syndrome. But most POTS is presumably from autonomic nervous system dysfunction and affecting their ability to regulate their blood flow. The typical symptoms of POTS include chronic severe fatigue, standing intolerance, meaning they have a hard time standing or sit up for extended period of time. If they do it, it causes severe palpitation, racing heart, very uncomfortable feeling. And also they have severe exercise intolerance, especially for cardiovascular training. They do have some generalized muscle weakness. And also they have a lot of gastrointestinal symptoms such as chronic nausea, sometimes vomiting, and they can alternate with constipation and diarrhea and sleep disturbances. Those are very typical and also debilitating symptoms.
Are you seeing more POTS patients since the pandemic started? And do you think that COVID could be causing POTS or triggering it?
Yes, for both questions. We've been seeing a significant increase in the number of referrals to our POTS clinic from patients who had COVID, and they recover from COVID initially, but they develop a set of symptoms that I mentioned, chronic fatigue, brain fog, and other gastrointestinal symptoms that are very typical for POTS. And oftentimes, most of the times, they do have, POTS by their clinical criteria. And yes, I do think there's a connection, not only these epidemiological connections, but I think there's an increasing suspicion that COVID virus may damage autonomic nervous system in certain ways, and as a result, it can cause POTS. Some doctors think that viral particle is hiding somewhere, still active, and causing slow damage to certain organs such as autonomic nervous system. Or it's possible that their body got rid of the viruses, but our immune system got confused and thinking that they still have a virus and inflames and attacking their own body tissue. In this case, maybe this autonomic nervous system. And either way, as a result, they have a POTS. And I do think that there's connection between COVID virus and POTS and autonomic nerve dysfunction.
As we did more research, we learned that many astronauts experience POTS-like orthostatic intolerance when they return from space. This piqued our curiosity, so we reached out to Dr. Levine, who has been working with astronauts since the 1990s.
A lot of the insights that I get about patients with POTS comes from studying astronauts, because POTS is fundamentally a gravity disease. So my name is Ben Levine. I'm a cardiologist and cardiovascular physiologist, and I'm a professor of medicine and cardiology at UT Southwestern Medical Center and director of the Institute for Exercise and Environmental Medicine at Texas Health Presbyterian Hospital in Dallas. And I put the first heart catheters in an astronaut. I think I've been involved in just almost every invasive cardiovascular experiment in the space program. So this is SLS1. Neurolab, also Neurolab, D2 and SLS2. So, one of the earliest problems that were observed, even with short duration space flights, is that astronauts had trouble standing up. In our studies, up to 2/3 of astronauts can't even stand for 10 minutes when they come back, even from a short duration of space flight. And that was really confusing. A lot of effort was exerted to try to understand why should astronauts have orthostatic intolerance. That's the medical term. Orthostatic is the medical term for upright, and intolerance is intolerance. So why should astronauts have that?
Is that POTS or is it just similar?
So that's and I think this is where there is some nuance, right? Astronauts don't develop POTS, but they do have orthostatic intolerance.
See, rider, see what you gone done. Oh, see, rider, see what you gone done. See, rider, see what you gone done. Well, hey, 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 hey.
Yeah, so I have been asthmatic since I was born. I also suffer from PTSD. I also was really not well for a lot of years. I was really burning the candle on both ends for a lot of years. When I got COVID before, nearly all of my friends, any of them who did, everyone was kind of like, yeah, that makes sense, But I was feeling really good.
As a child, I was chronically sick. I had rheumatic fever and a heart murmur. Later on, I got in a serious car accident. I had celiac after that and migraines. And then I had parvo B19. And then I have EDS. EDS is called Ehlers-Danlos syndrome. And it's a collagen mutation.
I don't have any pre-existing or didn't have any pre-existing conditions because I never had any of these issues before COVID. But all you ever heard was if you get this and you're young, you're gonna be okay. So yeah, I was worried about getting it, but I never thought that if I got it, I would be sick for a really long time.
Most of my patients in my POTS clinic, they are predominantly female in their usually 20s and 30s. And that's not just my POTS clinic. Actually, a lot of other clinics who see the similar patients see the same pattern, and we are beginning to see this similar pattern in post-COVID POTS patients as well. Predominantly more female, and a lot of them actually have some pre-existing conditions, EDS. Mass activation syndrome, and some autoimmune disorders like Hashimoto disease, thyroiditis in the past. So we believe that there may be some genetic predisposition that make them more vulnerable to get dysautonomia or POTS after COVID infection.
The point of which I felt like I had no symptoms for 3 days, I kind of started to pick up my life again, and spent June and July in a pretty normal way, other than insane UTIs and tooth infections. But then in addition to that, also I was ignoring my fatigue because I'm used to so much fatigue from being a burnt out educator. And so I would have 5 like pretty normal days and then sleep all weekend long. I kind of threw myself, as I was feeling better, into the next steps for my career, and literally the next week the rug was completely pulled out from underneath me and my time in bed went up like 70%, just being too exhausted to get out of bed and constant chest pain and shortness of breath.
I slept through all of April, and I'd just look out the window and look at the trees, and they'd bring me food, and it was just really hard. You know, after the flu period, I started feeling better, and I was like, oh, I think it was just that time of month, I'm okay. It was just a headache, you know, that I get before my cycle, and then my cycle happened, and then the respiratory stuff. But for me, it was surprising. I thought I was getting over it, and I was like, wow, I conquered it, I'm good.
Okay, so symptoms started with the headaches, the GI issues, and then it just progressed rapidly. So shortly after that, I started getting the shortness of breath to where I couldn't breathe at night. My O2 stats would drop to about 87, and then I would have a racing pulse of over 130. And then after that, you know, I was having a lot of the fatigue and just not feeling good. It's like you have the flu, but 10,000 times worse. Probably about 4 weeks in, I was like, something isn't right. And I was just like, I'm not getting better. I'm not recovering. What's going on? Gus is okay. I'm not. What's happening here? And that's whenever I knew this is a lot more serious than what people are saying.
I don't know if you can tell or not, but my cognitive function is significantly different than what it normally is. And there's times when people are talking to me and, you know, I felt like for the first time in my life I can truly empathize more with folks who have ADD and ADHD, because like I watch my brain go somewhere else and I'm like, no, you're supposed to be like listening to this right now. And then afterwards I just don't remember. I was talking about my summer with a friend a few weeks ago, and I said the thing about backpacking for 4 days, and he said, oh, where'd you go? I couldn't remember one scene from that 4 days. I couldn't remember anyone I went with. Yeah, it was really terrifying, actually.
But I get weird migraines, right? And so I thought, well, maybe it's just a migraine. And I called my doctor. She's like, go to the ER. So we went to the ER, and they're like, yeah, we did a CAT scan. We don't see anything on your brain. I did get physical therapy. I advocated for that. And in May, I started doing that. And then I started getting worse. And it was like movement was making me sicker. Like neurologically, I get these brain fries is what I call them later on, like in July. And so I kept telling my doctor, I'm getting these brain fries, like it's like concussion-like symptoms. And they keep happening when I do a lot of movement. They're like, try to, you know, just be normal. And I'm like, okay, you know. And I would get these headaches that were horrible and concussion-like symptoms. I'm like, I can't resume. Are these headaches, do I need to go to the ER? This headache is horrible. My arm is numb. Like, what can you do? So, you know, they just give me pain meds in the ER, which then makes things worse, you know? So then I know, okay, I can't take narcotics, you know? So process of elimination, but I still wasn't getting any help. And yeah, I need a break.
And then probably about 6 months in, I believe, that was whenever my cardiac issues started.
And I've been having a lot of cardiac issues since last month. And I decided to come in. I have a cardiologist appointment tomorrow, but yesterday my heart rate got up to about 194. The lowest, it was like 45, I believe, last night before I went to bed. A lot of shortness of breath, chest pain.
And they found that I had supraventricular tachycardia. I had instances of bradycardia, so slow heart rate. And I'm just like, what in the hell? And then after that, I mean, I started getting like the POT symptoms, so the blood pooling, the dizziness, and it's just like things have just continued to snowball.
And what's causing this array of symptoms? Because they're kind of all over the place. Why so many different varying symptoms?
That's a very good question. And of course, there is still a lot of research going on to figure out why, as one single syndrome that causes a lot of different symptoms. POTS is presumably thought to be coming from blood flow dysregulation. And because our blood flow goes to every single organs in our body, they can present symptoms in different organs. So I use this analogy every time. Imagine yourself as a water balloon that's attached to a pump. Okay? So human beings, 70-80% water, so that's not really far from truth. And we have a pump, basically that's autonomic nervous system that regulates our blood flow or blood volume. So for example, if you stand up from lower position, that pump can squeeze the balloon so it doesn't collapse. Or it can pump blood flow to your skeletal muscle when you're exercising, or brain if you're thinking, and different positional changes. Basically, you can think of POTS as a pump failure. The pump is broken. Because of pump failure, your body has difficulty sending blood to skeletal muscle when you're exercising, for example, or to your brain when you're trying to think. So a lot of POTS patients have this brain fog or lack of concentration because their perfusion is reduced. And also they have standing intolerance because the blood is not going up against gravity because of pump failure. At the same time, their bodies are increasing a lot of so-called adrenalines or sympathetic chemicals to compensate for the pump failure or try to stimulate the pump. Your brain is increasing a lot of adrenalines, and that causes a set of symptoms such as anxiety, racing heart palpitation, and sleep disturbance. They actually wake up frequently at night. They really can't have a rest, good deep sleep at night. So even if they sleep through the night, they have a hard time waking up in the morning, and they feel very tired in the morning. At the same time, because it's kind of fight or flight symptoms, they have reduced gastrointestinal motility. They're not digesting food effectively, and that predisposes a lot of nausea, vomiting, and constipation as well. But of course, we need more research to actually prove the theory at this point.
That's the mainstream theory for POTS. But based on his research with astronauts, Dr. Levine has another theory.
So in our studies, most of our astronauts on the first day back from space, their heart rate rose 35 beats per minute, consistent with what we use to diagnose POTS. POTS is much more than just a high heart rate when standing. The problem was mostly that the heart became too small. So when I stand up here in an Earth gravitational environment, gravity is sucking blood into my feet. And we're the only creatures on the planet that stand up. So when you go up into space, all this blood that gravity has pulled into your feet rushes centrally. Over time, what happens is a few different things. First of all, the heart gets smaller. And the heart also doesn't have to work hard to pump blood uphill to the brain. So over time, the heart gradually not just loses volume, but atrophies. Sort of like the opposite of the athlete's heart. We call it the couch potato's heart, right? And so the heart gets smaller and smaller and smaller. You also remember that you're very confined in space in a small capsule, so you don't have access to as much physical activity. You're not standing up, you're not walking, you're not fighting against gravity. And that leads to this phenomenon called cardiovascular deconditioning. When you come back down to Earth and now stand up, and let's say you've now spent 12 hours in a suit and you're hot and you land on the steppes of Kazakhstan and you try to stand up, well now gravity's working again, sucks blood back into your feet, the heart gets very, very empty, and the body tries to compensate for that by speeding up the pulse, right? You want to get the blood where it needs to go. The heart's just a pump, right? And it pumps the blood that comes back to it. And if not so much blood is coming back, you got to pump faster. So that's why the heart rate goes up. And in some astronauts, particularly those who are susceptible, they actually faint and will lose consciousness. A lot of the work about the circulatory control and control of the cardiovascular system that we've extrapolated to spaceflight comes from bed rest. Okay? Why bed rest? Well, when you lie down, the hydrostatic gradient, gravity from head to foot, is gone. So it turns out to be very much like spaceflight. And it turns out that when you put someone to bed and you don't let them do anything, right? So completely sedentary, you lose about 1% of your heart muscle mass a week in bed. That's a huge amount, right? Guess how much the average POTS patient's heart muscle mass is below normal? 25%, equivalent to someone with a spinal cord injury.
So I think I've been in the ER 4 times throughout these 9.5 months. When I went in, they definitely asked me questions that, as someone who doesn't suffer from anxiety, I sometimes feel annoyed when that comes up and they're kind of assuming that I'm having a panic attack instead of having the symptoms that I'm having.
Just, you need help so bad, and they just didn't do anything. They should have done an MRI, they should have listened, they should have.
I went to the ER on 3 different occasions and I was turned away every single time because they said that I was young and healthy, and that was hard.
I've been questioning myself a lot and, just being dismissed over and over and over again whenever you feel like this, it's not been fun.
It just was both frustrating to not be believed, as well as there's this whole thing with being a long hauler, and I know it's the same with a ton of chronic illnesses, of this journey of being gaslit and having people not believe you, and then you attending the support groups and reading up on all the research. It's just you already feel like crap, and then on top of that you have to do the research that your doctor's not doing.
And they think, oh, follow up with your PCP, but they don't want you in the office. They don't want to be near you. So you do things over the phone. They can't see everything. They can't acutely see all your deficiencies, and inside you want to be better. You want to be yeah, look, I've improved,
my O2 stats were dropping to 87 at night, and I would have a racing pulse of over 130, and it's just like, I'm telling you guys, I cannot breathe at night. I feel like I'm being strangled. Like, this is terrifying.
And even like the medical assistants sounded annoyed when I would call and be like, my chest hurts really bad. Like, isn't there anything, like other things we can look into? Or, be like, it was kind of like, oh, it's Emily again. It really felt like that. And I'd come in and they they used to be cheerful and they would not be.
And I was like, I cannot go back in there because they're just gonna send me home like the other times, Why would I go pay money for them to be like, you're fine, when obviously I wasn't, I couldn't even walk.
And actually on one occasion, I had a doctor tell a nurse to tell me, while I'm in the ER, mind you, not to come back.
There's this vibe of like, why are you taking up space where people who are actually sick should be here, And my doctor would just kind of stare at me with these like dead eyes and try to push anti-anxiety meds or more asthma meds.
And then she was getting like frustrated with me. And I'm like, I'm just sitting here listening to you convince yourself that I need to be on drugs for depression. Okay. Are you anxious? I asked her.
So it was a mental battle because I knew something was really wrong with me, but I couldn't get any help.
Why does it take so long for patients to get a diagnosis of POTS? And how long does it typically take them to get a diagnosis?
It takes usually several years on average before they get to seen by any POTS specialist. Probably one of the most obvious reasons is that there's a lack of awareness, not among patients, but also among doctors as well. This is not something that we learn in medical school. And also the diagnosis of POTS is a relatively recent term. It was not until early 1990s where the term POTS was coined. I think another reason that it may take a lot of time before patients get diagnosed with POTS is that it is very difficult to evaluate autonomic nerve function. The patients may have symptoms in their muscle or gastrointestinal system or brain, but each organs usually are normal if they go to specialists for, let's say, brain, kidney, or muscle. Because their fundamental problem is their autonomic nerve problem, and as a result, they have difficulty regulating their blood flow. And believe it or not, evaluating blood flow is really not that easy. So that's also another reason that it takes a long time before they get diagnosed with POTS. It's kind of unfortunate that some doctors dismiss their symptoms just because the test that they're doing is normal, and they just stop investigating it. If the symptoms are bad enough that they cannot, continue to work or go to school, I think this should be taken very seriously. And another thing, probably for the doctors out there, is that just because their typical test comes back as normal, it doesn't automatically mean that this is all psychological in nature. I think it's important to listen to patients and don't stop until we get good answers for their problems.
Has COVID changed the awareness of POTS? It seems like a lot more people are getting it and a lot more people are talking about it. Are people becoming more aware of it? How has COVID impacted this?
Yes, I think so. Especially after COVID pandemic, now a lot of doctors are gaining awareness and talking more about POTS.
But I'm just tired of feeling bad. Oh, so tired of feeling bad. I miss my old life, like just feeling good, like I miss it.
It's my bag of drugs. it's a whole thing twice a day. I have my gummy. I went for some gummy multivitamins because the other ones are some pretty foul tasting pills to swallow.
Yeah, this is the stash. These are my oriental herbs. And then I get, this just picks me up. I just like put it on my tongue and it just, so I'm not drinking electrolytes all day long. I just put salt in my mouth. It's great.
So what do you do to treat POTS?
Now, first, as I said, this is pump failure, so the body's having difficulty regulating the blood flow. Well, first of all, because if this is pump failure, it would be great if you can fix the pump. But unfortunately, like I said, we need more research to prove the pump is broken and how it's broken and how to fix it. And we are not really there at this point, unfortunately. We just need more research to really fix the pump. Now, however, the good news is that there are actually a number of things we can do to make symptoms better. So now imagine filling the balloon with the water and expand the balloon. What happens is that it's going to build up pressure and it's not going to collapse. We don't need a pump. We still can have volume expansion and allow our body to regulate blood flow much easier by expanding the balloon. And that's why we recommend patients with POTS to increase their water intake and salt intake, because if you just drink water, it's not going to cannot be kept inside of the balloon. You have to have a salt inside of the balloon to increase blood volume. Now, when I say volume expansion, I just don't mean drinking a lot of water and sodium. There are a lot of other things to achieve volume expansion. There are a lot of medications to help the volume expansion by retaining water or fluid in the body. There are special forms of rehabilitation or exercise that can increase blood volume as well. So we do combination of these different modalities to really achieve volume expansion for the treatment.
And so the problem, after lots and lots of research, for astronauts is that their stroke volume was too low in the upright position. And that's the sine qua non of the cardiovascular adaptation to spaceflight. How do I know that that's the problem? Well, to convince a skeptical person like you, I'd have to tell, well, to make the heart bigger and fill it, the syndrome should go away, right? And that's what we found. That now astronauts do lots of exercise in space, and they get volume infusions when they come down to Earth. And in our last set of studies, after 6 months in space, not a single person fainted on the tilt table, 0. And so a lot of the rehabilitation strategy that we've taken for patients comes from what we do for astronauts. There are lots of different pathways to POTS. That's what makes it so difficult, right? It's not just one thing. People can get there from an infection, from inflammation, from an injury, from going down to bed, from many different possible things. But the final common pathway, by the time they get to me, is that they have markedly reduced their physical activity. What people don't understand is how quickly this process begins. We've done some studies showing that even 20 hours of bed rest initiates the process. And so we often see that many patients with POTS were very active and athletic beforehand, and their bodies then are adjusted to this big heart with an expanded blood volume and relaxed blood vessels. They go down to bed even for a short period of time, and they lose some plasma volume. They get hypovolemic. They stand up, they feel lightheaded and dizzy. So what do? They lie back down. And it's this downward spiral of progressive deconditioning. We see it all the time. And I had one young woman who was a professional dancer who had not been upright. Her parents rolled her into my clinic in a supine wheelchair. She had not been upright for more than 2 years. She had not stood up for 2 years. And we had to develop a special rehabilitation program for her. But after she completed the training and rehabilitation program, she starred and choreographed her own ballet. So So this fulfills many of the postulates, both for astronauts. If you can prevent the cardiac atrophy, if you can fill the heart, if you can rehabilitate them quickly, they quickly adjust to a gravitational environment. And patients with POTS, if you, depending on when you get them, of course, if you rehabilitate them, make the heart bigger, it makes a lot of their symptoms go away.
I feel really cautious around having hope. I feel like I'm on a bit of an upswing right now, but I don't want to put too much into it. I don't want to make plans, serious plans right now, because I feel like it's very possible in another month or two, it could just pull the rug out from underneath me again. And so that makes it really challenging to know what to do with, work and any number of decisions about life. I'm really buckling down for the long haul,
This was like the hardest, most trying time ever. I didn't even think there could be anything like this. Like, you just can't fathom it. And then on the other side, you have so much good and stuff you can't even fathom either on the other end of miraculous. And so I really feel like life can have that balance, and I feel like God wanted me to see that. He wanted to see, yeah, I can't take your trial from you. That's why we're here. We gotta grow. We can't grow if we don't have weights to lift, But I'll help you when you don't think you can lift it anymore. And so my faith has actually gotten stronger, and it's a beautiful thing.
Yes, I am a COVID survivor, but I refer to myself as a long COVID patient because I'm still a patient for the unforeseeable future. And it's just so important that people know that anybody can get this and be in my shoes, and to cherish your health because it could be ripped away from you at any point, especially now. I promise myself that if I get out of this, I'm gonna do something about it. I'm gonna use my voice to help others. I have started a long COVID research and mental health advocacy nonprofit called Blooming Magnolia. And our mission is to basically empower those, and support those going through mental health issues with a platform, to have resources and such, and also raise funding for the research of long COVID for the therapeutics and treatment. Even before COVID came around, this is something that I wanted to do. Sometimes your gifts come in really ugly packaging, but sometimes, you just gotta reframe it and turn it to gold. And so that's what I'm trying to do.
As we interviewed more survivors, we noticed an unsettling trend of people diagnosed with POTS after catching COVID. We don't know how widespread this is yet, since there is limited research and doctors who can diagnose it. For now, the evidence is mostly anecdotal, and every patient is unique. Before the COVID outbreak, POTS was known to affect approximately 500,000 people in the United States. But with POTS clinics overwhelmed with waitlists nearly a year long, I'm guessing that number has grown significantly. The apparent link to COVID is still a mystery, and answers are elusive. But one thing is clear, that more funding is needed to research POTS in order to provide better treatment and care for the growing number of POTS patients.
On day 5 of COVID, I bled like no other.
Sometimes my cycle would last 3 weeks, 4 weeks.
I started seeing increase in irregular bleeding, sometimes heavy.
It was almost like I was hemorrhaging for 8 days straight.
And the heaviest bleeding.
After the COVID infection, also noted after the vaccine.
I started thinking about possible risks associated for erectile function and COVID-19.
I have sexual issues.